one of the ways we've tried to mold the pet health zone is so the age period, the life stages, if you like, those are specific to each breed. So they are designed to emulate the way that you experience your pet's life. Being able to say, okay, even if I have a puppy or a young adult, being able to step through the life stages and know what I can expect.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
Hello, I'm Molly Jacobson, Editor-in-Chief at dogcancer.com. Today's guest is Dr. Jules Benson from Nationwide Pet Health Insurance. He's the Chief Veterinary Officer there and a total data geek. So he has been looking for several years now at 1 million+ claims that Nationwide, nation's largest pet insurer, has collected and paid out on. He's got a lot of data to look at about what dogs, cats, and other animals have been dealing with and facing over the years. His team has been analyzing all of that data and writing white papers or sort of informational papers on what they find. And now they've launched a new tool that anybody can use, and you don't have to read. You can literally just put in a few points about your dog and get a lot of information back about what they might be facing in the future. So today our host, James Jacobson, sits down with Dr. Jules Benson, who walks us through the pet health zone. This website has already helped James and I look into the future for our little rescue dog, Chloe, a Maltipoo, and give us a little heads up about what might be coming down the pike in the next couple of years for our senior dog. Today's episode is for you if you are wondering about a dog that you have currently, but also if you're thinking about getting a new dog and you know what kind of dog you might want to get, or you're considering getting a specific dog in your local shelter. You can plug in their data and see what might be happening not only to that dog, but in your area in the future. Let's join James Jacobson now as he speaks with Dr. Jules Benson. Oh, and one quick note about today's video version of the podcast. During the recording, nobody noticed that Dr. Benson's video was stuck after the first couple of moments. His audio came through great, but his video did not. And his face was sort of frozen in a weird expression. So we decided rather than using that as the video footage, to use lots of cute doggies. So hopefully you won't mind and you'll get a lot out of this episode. Thanks for your understanding. And now let's get to the show.
Dr. Jules Benson, thank you so much for being with us today.
I'm glad to be here, James.
So you have been on the show a few times, as I was joking with you beforehand. You've got your frequent flyer miles on
I
Dog
think
Cancer
so.
Answers.
I'm hoping to redeem them for some kind of plush toy or maybe a drink. I mean, it's
medallion status or something like that. Yes, we'll do that. I think if you hit 5, then you get something special. We'll give you a Dog Podcast Network coffee mug. So on this episode, though, I want to look at a new tool that you guys have recently introduced to the public. And it's obviously designed a little bit to sell insurance. But what it is a pretty interesting way to, find out more about your dog and their health risk. It's called Pet Health Zone. Tell us about it.
Yeah, so the Pet Health Zone, so www.thepethealthzone.
You mustn't forget the Pet Health. Okay. Is the other place going to bring us to a naughty place that we don't want to visit?
I hope not.
Okay.
But the Pet Health Zone, we launched this back in June of last year with initially 50 dog breeds. We just updated that. So now we have, I think, just over 100 dog breeds and 11 cats. So I know we're Dog Cancer Answers, but I'm sure we have some cat people out there as well with their dogs.
Sometimes they have cats to accommodate the dogs. Yeah.
So the Pet Health Zone really is, we started out using our data, and this is what I talked to Molly about before with our white papers, like trying to really find ways to dig into our millions of years of insurance data and find meaningful ways to reach pet families and veterinary healthcare teams with that. I think what we were understanding as we were going through this was that it's great to provide this very deep and very, in some ways, academic information, and to be able to come on things like Dog Cancer Answers and be able to explain that for pet families. But what we were missing was, how can we reach pet families directly, and how can we make this a a really good learning experience for them. Because I think one of the things I've recognized being in animal health industry and when I was in practice is that education can be boring. For my own healthcare, I'm like, I know I need to read this about my own healthcare, but I'm like, oh my God, it feels like I'm being grilled on like what are the things that I need to know about my health. And I think one of the things that really struck out with the Pet Health Zone, one of our team members struck on the word, which is delight. We want it to be a delightful experience.
In terms of your language, as you talk about, one of the things as someone who reads a lot of white papers about cancer and about medical issues, I have always been struck by how down-to-earth, jargon-free it is. Pretty much what we do at dogcancer.com, which is make it kind of, there's a lot of meat there, but you don't have to use a lot of, $5 words to describe it. Or if you do, explain it.
Well, and that was a goal. I mean, and it was one of those situations, actually, we talk about this a lot internally at Nationwide. This is one of our first projects using generative AI. So we actually use generative AI to source some of the information, or to interpret the information to a reading level that would feel approachable for pet families. So we were using reputable sources. It went through, I think, at least 3 or 4 different sets of veterinarians' eyes to make sure that the content is accurate and helpful. But we really wanted to make sure that this one of the things that generative AI I found is really good for in terms of saving time is like, can you give me 137 characters at a 9th grade reading level based on these sentences? And it's amazing.
So the generative AI is interesting. So you basically did use AI to help, make sure the language was easy. But as you say, this is all vetted by vets.
Yeah, and all internal.
Like what we do at Dog Cancer, Doctor.
Yeah. Well, and all internal as well. So I think one of the things, and myself working in the industry for such a long time, often these projects are sent to agencies or they're sent to somebody else to do the mechanics of this. Everything that's done within the Pet Health Zone is performed by the team at Nationwide. So we have data scientists, we have award-winning authors, we have veterinarians. So this really is an internal effort, and our contribution to how do we try and get the best quality information out there that we can.
Absolutely. So let's, I guess, give folks who are both listening and watching a little tour of this, of the Pet Health Zone. The Pet Health Zone. I have a 6-year-old Maltipoo. We don't know exactly for sure because we rescued her. Her name is Chloe, which is interesting because your site also talks about like common names for breeds. And of course, a Maltipoo isn't really a breed. It's a mix.
It's a hybrid. Absolutely.
It's a hybrid breed.
Yeah.
But the granularity of what you have enables you to say, yes, I have a Maltipoo. So, I learned that, she's a crossbreed and a little bit about her and her energy level, but it was a couch between a couch and a lightning bolt. I'm assuming between
a potato and a lunatic, I think is kind of.
So you had all of the things lit for that. So I'm assuming that it could be any of that, which is.
I think it's if it's fully lit, then it's towards the lightning bolt side of things. Of like things can get pretty crazy in the Maltipoo house. Apparently,
I get it. Yes, and she can also just be very adorable when she lays to get long belly rubs. And so basically, bark level, talkative, right on for this hybrid breed. But that's kind of the stuff that you can get all over the web. And then learn a little bit about Health Planner, which I think is a very clever thing, a service mark. This is kind of what is interesting, and this is based on this vast amount of data, I imagine, that you guys have amassed with how many claims now? How many dogs and cats do you have in your database?
So it's this is based on about 23 million years of dogs, I believe, of pets actually, so cats as well.
You don't mean years.
23 million years. So if
I see. If a dog lives to 10, that's 10 years.
Exactly.
That's a way to
boost
that number. Okay. Yeah.
Well, I mean that's
how many months? Yeah.
Being an insurance company. That is how we look at we call it about exposures, right? There's a number of months or a year. Like you basically say, if you're writing a policy for a year, that is 1 year of exposure. This is 1 year that we are insuring this pet.
And is this like compile? I mean, I think of actuarials who, do all that stuff on the human health side. And I imagine also you have a bunch of actuarials who are now on the pet health side.
So we do, and we do work with our pricing and actuarial team, but we also have data scientists who are dedicated to our pet health efforts as well. We do have the benefit of reaching across nationwide and across our own organization, but we also have a lot of expertise that we've built.
And that's obviously, for the preservation of the bottom line, the profitability, to make sure that, you guys can sustain that, but then it has applicability to pet owners to understand a little bit more about what's happening.
To a degree, I mean, I think the specificity that we're getting into with the data that's in the pet health zone, that's not necessarily something that pricing team are always interested in, because they're basically, hey, if I have a 6-year-old Maltipoo, they're interested in what is the accumulation of things that have happened to it, and therefore what premium does have to be. And when we talk about how we like to approach our members at Nationwide, it's like, how do we be effortless, personal, and reassuring?
So again, this is Dog Cancer Answers, and I was very relieved to see in my pet health planner that cancer was not one of the things that, is a likely outcome.
Right. Yeah.
So I'm assuming that other breeds would indicate that.
Yes, indeed. So, and talking to Molly previously, so some of the data that we'd had in our white papers, and very, very broadly, were that, cancers unfortunately are more common in purebred dogs, or that they're higher risk, and that they're higher risk in dogs as they go up the size. So you've got this great mix of all these things of not being a purebred dog and of being a dog that is a small to medium sized dog. And a Bernese Mountain Dog is a great example of, like, when you go to a senior Bernese Mountain Dog, then you're seeing lymphoma, you're seeing splenic cancer, you're seeing bone cancer, right? These are the top 3 that pop up for these breeds. Having that awareness of the thing that could happen breaks down some of those barriers to communication, and I think just some of the awareness of this is in the realms of the possible now.
They're not hearing it they think they're going in 100%. For like it's a little bit of arthritis, and then it's something much bigger.
So even when there's something that we couldn't do in that case, I mean, the dog is already in the exam room. It allows the pet owner to have a different experience than they might have otherwise, and it allows the veterinary healthcare team to have a different experience than they might have otherwise as well. So for us, there's at least a level of communication and education that can happen that eases some of this process.
And knowledge is power. So just knowing what is possible for your dog ahead of time empowers you to say not to dismiss it, because oftentimes veterinarians are not going to on a well puppy check going to say, well, you really should be looking for this thing down the road, because that just wouldn't be very fun for anyone.
It's also hard. So I think when we talk about so as a veterinarian, so I had Bernese Mountain Dogs in our practice, but I probably only saw, I want to say, less than 10. So I knew some things that happened, and I had my own experience to count on then. But the Pet Health Zone uses data from 25,000 years of Bernese Mountain Dog. We've seen them often enough that we kind of have a really good idea of what's going on there. But when you get further down the list, whether it's Berners, whether it's Rottweilers, whether it's Havanese, whether it's Maltipoos, there's not a lot of data about those dogs that exist at the moment. So we see this really as a primary source of really consequential and significant data.
Right. But it does do a good marketing job, because, like, for example, for the things that Chloe could have, like, the dental, which seems to always be the problem with my animals. I don't know. Little animals have bad 100%. Teeth. The potential cost is $940. In theory, I typed in my zip code. Yeah. I don't think that would actually be the going rate where I live. But yes, we'll go with that.
And the cost isn't. It's a great example. So the costs are not regionalized at the moment. That is something we're working on. This is at the area this could be in. Let's at least have an awareness of what the cost could be. And I think when you get to cancers, for example, there's some 3,000, some 5,000. It's just trying to drive the awareness of what are the things that we can expect. Again, even if you're not insured, if you don't have insurance, at least having the awareness of what the cost could be.
So when it comes to cancer, I mean, 3,000 sounds very small. I think the average that I know of, and it's been this way for years, is $5,000 to $8,000 on average.
And depends on the cancer, depends on what you're doing. But yeah, sure, there's absolutely some, and this is focusing on the first 30 days generally. So if we're talking about lymphoma, this will be what is our diagnostics, what are our initial treatments, and then obviously there's a longer period. So the price is an area that the cost of care is an area that we're experimenting with for things like lymphoma, where we have a longer tail, no pun intended. Should we be using a 12-month period for that rather than a 30-day period? So again, trying to provide more and more accuracy with this to try and make sure that people have a better awareness of what could be going on.
Let me pause here and break in for a quick word about our sponsor, dogcancer.com, where all we do is bring you awareness about what might be going on in your own dog's cancer, lymphoma, or any other kind. We are a team of veterinarians, veterinary oncologists, cancer researchers, and science writers who all understand what it's like to have a dog with cancer. We really get the emotional side of this, and we also understand how much information there is out there for you to sift through. So we try to make it all make sense and write in plain language so you can understand everything that's being said and bring it back to your own veterinarian to see how it might apply to your dog's case. That's dogcancer.com. Go there anytime you have a question. Start your research there. That's dogcancer.com. And now let's go back to our conversation with James Jacobson and Dr. Jules Benson of Nationwide Pet Insurance.
So this tool is going to evolve to incorporate, because it did ask for my zip code, but
yes.
So it'll go to look at what yes. a cancer treatment would be in your zip code and based on that type of cancer. And then of course, well, this is how much you would pay, but with pet insurance, it would be this. So, for example, for dental, $940. But anyway, pet insurance would be $94, and I'm assuming that actually is pretty accurate because that is what. Yeah. So it makes a very powerful statement, which is, of course, the marketing rationale. The reason you all are doing this is to educate people about pet insurance and its overall value, which I think. Not enough Americans appreciate. And you went to school. You're not actually from the United States, right?
I'm not from the US. I'm from the UK originally. So we have a different perspective on pet health insurance.
Way different. Will you share that with folks? Because I think that most people don't know about this.
Yeah. So in the UK, and the numbers vary, but about 30% of pets are insured in the UK. It really does change the way that people can look at veterinary care.
Versus America, which is currently...
It's about 3%, yeah.
And that's an improvement over just a few years ago.
Yeah, so the pet health insurance industry in the US is growing fairly rapidly. I mean, and if you look at any industry and you said it's growing 20% year over year, that's a high growth industry. But of course, when you're growing from 2 and 3%, that can still feel unsatisfying knowing that there are so many pets out there that could use these types of services.
Is it, and sort of culturally, do you think, what is it? Because like in the UK, you have National Health Service and it's socialized medicine. So people kind of have that expectation, or what do you suppose?
I think veterinarians have been a little gun shy to be as involved as they could or should be. I think in the UK, for example, the regulations are also different in that you can actually, if you get a new puppy or a new pet, you can walk out of a veterinary clinic with 30 days of free insurance. And that's a great way to get people started and to show the value proposition and we just can't do that here. That's not the way that insurance is allowed to work in the US. I think we're getting more and more veterinarians who are interested. And I think we've seen that in the growth of the number of companies who are selling pet insurance, right? We've seen that grow quite appreciably in the last 10 or 15 years. So, and I think the consumer awareness, I think we continue, our job as insurers has to be to continue to show the value proposition, to show how it works for them.
And in terms of the distinction between the UK, obviously you have, I want to make this clear, government-sponsored healthcare for humans, but there's no government involvement in that for pets.
Correct. Okay. Absolutely. Yeah. In the US, we have a greater mentality around an understanding or knowing that we might be paying for our own healthcare and therefore for our pets' healthcare. And so perhaps the incentive to insure can feel less. I think the most avid proponents of pet health insurance that I've met have often been people who've been through, very expensive situations with their pets before.
Rates do escalate over time, but the fact that you start early, that reduces that.
Yeah, I mean, the starting early, I think one of the ways we've tried to mold the pet health zone is so the age period, the life stages, if you like, those are specific to each breed. So they are designed to emulate the way that you experience your pet's life. You wouldn't call a 6-year-old Chihuahua a senior, but you might call a 6-year-old English Bulldog a senior just because their life expectancy and their lived experience is different. So this is meant to mimic that, being able to say, okay, even if I have a puppy or a young adult, being able to step through the life stages and know what I can expect in terms of high risk conditions. These are some of the reasons that either having an awareness and then having a financial plan around it seems like a good idea.
Are there things that are pre-existing conditions that are not cancer that an adjuster would look at and say, no, that dog had that, so we won't pay for the cancer after the cancer diagnosis? If
you have any doubt over whether something will be covered, just go ahead and make the assumption that it won't be, and then see if the value proposition is still worth it. So if your dog is limping and you're worried it could be a cruciate ligament injury, assume that won't be covered if you take an insurance policy out now, because the clinical signs have already started. And so, and from that point of view, if you really wanted to cover that cruciate ligament, that's probably not going to be worth it to you for value proposition. But if you're just now realizing how expensive care can be, and the cruciate ligament's not going to be covered, but you obviously want it for cancer or for allergies or whatever else, then go ahead and do it. And I would say speak to a licensed insurance agent. You can have some of these conversations. Yeah.
But as it relates to cancer in general, which again is what a lot of people watching are interested in, then so long as your dog has not been diagnosed.
So long as your dog is not showing clinical signs. So if your dog has been, even if it's not doing well, and we know the early signs of lymphoma can be subtle, for example. So if there are early signs of lymphoma that can be related to the disease, that would not be covered by a policy.
Okay. And then there's a waiting period between inception of policy and when it would be covered.
Correct, and that can vary by state. So I would say, ask an agent or look online when they do it.
The increased enthusiasm and interest in insurance that we're seeing in the States what do you attribute that to?
I think some of it is
good marketing like this, or is it something else?
I hope so. I mean, I think we're seeing more and more concerted marketing efforts that I think are speaking to more people. I think we're seeing more veterinary healthcare teams who are enthusiastic about it. And I think we're seeing more recognition of the increased cost of care. And when I talk about cost of care, I'm not talking about your veterinarian is putting up the cost of their exam. I'm talking about, if you think of where we were 10 years ago with cancer and cancer treatment, things have got even so far in the last 10 years. So we're not talking about just price increases, we're talking about the opportunities to do more.
And what about the role of things like telemedicine and like oncologists who consult, but are not actually seeing your pet, but they're working with your vet?
And I love the teleconsulting model. I think that's and for those who are uninitiated, telehealth is the broader area. And then we've got things like teletriage, which every nationwide policy has a teletriage option. So 24/7, you can talk to a veterinary healthcare team member. So if your pet ate something, or if you want to talk about, and actually for cancer, my team and I, we think that telehealth is a great opportunity to talk about things like quality of life.
So, and that is covered by insurance.
Teleconsulting, yeah. If it's through the veterinarian, yeah, absolutely.
Yeah. Okay. So that's a really, because we're still in its infancy with that. But as we've talked about so often, there are only a few hundred veterinary oncologists in all of North America. Yeah. And more of them are setting up that consultancy. Yeah. So if you have insurance and your vet wants to do it, and it's sort of a prudent thing.
Yeah. And it's really exciting. I think as we start to see, I have friends who've worked in diagnostics. So, basically virtual diagnostics. So the veterinarian takes the picture of the slide and they send it to a pathologist. And it's like, there's some really cool things happening with technology that I think will really enable access to care for pet families in the next 5 to 10 years.
Well, whenever I do one of these shows, I love to geek out on the technology. And so I loved what you were talking about earlier in terms of the, LLMs used to make this language better. But what do you see or what are you guys offering now that leverages some of that technology?
So it's really interesting. So I serve on the board of the Veterinary Innovation Council, which is a national body made up of veterinary leaders. And we have this conversation all the time about AI and what can and should we be doing from a leadership position around AI. And I think we're starting to see some of the really interesting cases around areas like radiology. So in human medicine, we already know that the AI is being used increasingly in areas like radiology and pathology. If you've read around this, you'll be aware that our brains are pretty good at having 3 to 5 pieces of information in them. But once you get beyond that, it's really hard for us to parse those together and to say, I'm going to take, it's the beautiful mind thing, right? Of like, I'm going to take all these things and put them together in a genius way. And AI is really good at that. And
it's not limited to 3 or 5. It's infinitely limited. Yeah.
100%. And so having that level of support, so not AI making decisions about healthcare, but AI supporting our ability to provide healthcare, I think it's a very exciting area.
And I happen to know that veterinarians and data scientists are not necessarily the best writers at 8th grade, and so maybe a little help from let's make this more easily accessible.
We'll take the help that we can get, and I think you talked about veterinarians and data scientists in the same breath. So I'll take the opportunity to say I think we have an opportunity in veterinary medicine to really elevate and emphasize the role of data scientists in veterinary medicine. And I think that's something that we've tried to do over the years.
Well, I'm intrigued with the fact that obviously Nationwide is best known for, I guess, human health and cars. We got
the jingle.
Yeah, all that stuff. So what role does all the data and understanding and analytics about human health fit within what you're doing, and is this in any way connected to One Health?
It's a great question. So we're actually just in the middle of writing a couple of peer-reviewed papers that talk about One Health and One Communication. So everything
One Communication.
One Communication. So One Communication is a subset of One Health, which talks about how we can use learnings from communication studies. It's basically translational. How do we use our learnings in human healthcare to parlay those things across to pet healthcare and make more meaningful communication opportunities for pet families?
Well, that's what I'm fascinated with, because this podcast started back in 2008, sort of as a way to talk about a book that is the Dog Cancer Survival Guide, which is the best-selling animal health book in the English language or something like that. And so many people read that book and then commented that not only was it helpful for their dogs with cancer, but when they or someone else, there's like, why don't you have a human person's survival guide for cancer? Person's, I don't know, whatever, people's survival guide.
Human person.
And so it is going, so that I've heard that anecdotally, but you're saying that there are other things where people like the way that things are communicated as it relates to their pets that could have applicability for people.
So I think on the communication side, we're taking more advantage of the human side. I think from the medical side, so that you're talking about the translational medicine side, I think when we look at cancer as a kind of a hotbed of how do we use understanding of canine cancer to learn more about human cancer? Like we're seeing more and more of that research being focused as well. And I know that many of the oncologists that you'll had on over the years, whether it's Craig Clifford or Sue Ettinger, like I know they have interest and are often asked to be involved in translational medicine efforts. So I think from a One Health perspective, how can we take our learning in either space and translate that over? The other area that's seeing a lot of press at the moment is around increasing health span of pets. So there's a couple of drugs coming on the market soon or are being tested and have conditional FDA approvals that might extend the health span of pets.
Do you think that might be an obesity? People may be getting a doggy Ozempic someday? We already had an attempt at that with Slentrol, which was launched about 15 or 20 years ago. And so there was it's not a GLP-1, so it's not the same class, but we certainly had a drug that was aimed at obesity in pets. Yeah. I mean, and I just had the opportunity to speak to the leader of the Dog Aging Project recently. And they're doing some amazing work over there. But the one thing we can agree on that does extend life at the moment is calorie restriction. We love having you on the show because you have such a wide spectrum of things to talk about, Dr. Benson. I want to thank you so much for being with us today. I encourage folks to visit thepethealthzone.com and learn things about your own dog. You can also compare it. And I guess you actually can type in your email. Does that subject people to a lot of like marketing emails, or is it just basically...
You get some more information about that. You may get some emails about your opportunities to take pet health insurance as well.
Dr. Jules Benson, thank you so much for being with us today.
Thank you again to Dr. Jules Benson, and thanks to you for watching. Do you have pet insurance? Have you used it? What has your experience been? Have you discovered the Pet Health Zone, which we've talked about on our channel before? Have you used it for your own dog or to help you decide about a new family member to bring into your home? Leave a comment and let us know your stories before. And if you want to make it a longer conversation, please go to dogcancer.com/ask and leave us a video message there. Remember to like and follow us here on our channel so you'll never miss out on more content. I'm Molly Jacobson, and I'll see you soon. Don't forget to give your dog a hug from me.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcancer.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.